Welcome to our new video. So in this video we are going to discuss important MCQs related to the topic conductivity in dialysis. So all these questions which we are going to discuss in this video are important for the examination. So let's begin. So here the first question that we have, it says conductivity of dialysate primarily reflects concentration of. So out of these four options we have to choose who influences the dialysate conductivity most. So option A is glucose, option B is sodium, option C is urea, option D is creatinine. So like in the previous video we discussed, we know sodium concentration primarily reflects conductivity. So sodium is the major electrolyte present in the dialysate. Since conductivity depends on dissolved ions, sodium contributes the maximum to electrical conductivity. Therefore, conductivity indirectly indicates sodium concentration. You can also see the concentration of sodium in the dialysate per liter. Moving ahead to the second question, it says conductivity in hemodialysis is measured in. So we have to tell the unit of measuring conductivity. So is it mmHg? No. Is it milliequivalent per liter? No. Is it millisiemens per centimeter? Yes. Is it mg per deciliter? No. So the right answer is millisiemens per centimeter. Now there is a catch. Conductivity measures electric current flow through solution. Its units is Siemens centimeter in actual, but because in dialysis this value is very low, so we measure it as millisiemens per centimeter. So whenever they ask you about in context to dialysis, you have to answer millisiemens per centimeter. Moving ahead, in the third question, it says normal dialysate conductivity ranges approximately. So we have four different ranges and we have to find the right range. So for option 1 is 5 to 7, option B is 8 to 10, option C is 13 to 15, option D is 18 to 20. We all know it ranges from 12.5 to maximum 16. So this is most nearest to this range. So yes, this will be the answer. So here proper mixing of acid concentrate bicarbonate and RO water procedure produce conductivity around 13 to 15 millisiemens centimeter. Values outside this range indicates incorrect dialysate composition and unsafe for treatment. Moving ahead to the fourth question, it says low dialysate conductivity indicates what? So if there is low dialysate conductivity, what does it possibly means? So option A says excess electrolyte concentration, option B is diluted dialysate, option C is increased temperature, option D is blood leak. So I think we also discussed this in our previous video. So the answer will be diluted dialysate. Now what happens? Low conductivity means fewer ions are present. This usually happens when excessive water mixes with the concentrate, leading to low sodium dialysate and risk hypotension and cramps. Moving ahead to the fifth question, it says high conductivity alarm during dialysis usually indicates what? So we have high conductivity. So what does that possibly means? Option A says low sodium concentration, option B says excessive electrolyte concentration, option C says air in bloodline, option D says dialyzer clotting. So higher conductivity means we earlier learned that more ions, more conductivity. So the right answer will be option B, excessive electrolyte concentration. High conductivity occurs when dialysate contains too much concentrate or insufficient water. Also insufficient water. This increases sodium levels, which may cause hypertension and excessive thirst in patients. Moving to the sixth question, it says the dialysis conductivity is mainly monitored to ensure what? Option A says blood pressure stability, option B says correct dialysate mixing, option C says advocate anticoagulation, option D says sterilization, dialyzer sterilization. So this answer will be B, correct dialysate mixing. The dialyzer machine mixes RO water with acid and bicarbonate automatically. Conductivity monitoring confirms the mixing ratio is correct and safe for the patient. Moving to the next question. Now the seventh question says, which component change most directly alters conductivity? Which component? So options are here. Option A says dialysate temperature, option B says sodium concentration, option C says blood flow rate, option D says heparin dose. So we previously also talked that sodium concentration directly changes the overall conductivity. So the answer will be, although many electrolytes contribute, sodium concentration changes produce the largest effect on conductivity reading. Moving to the eighth question, it says a sudden fall in conductivity during dialysis may cause hypertension, muscle cramps and hypotension, hyperglycemia and fever. So there is sudden fall in conductivity. So earlier conductivity was more, now it is less. So what is going to happen? So when low conductivity happens, it means low sodium dialysate. Low sodium dialysate means rapid osmotic fluid shift from blood, which means decreased blood pressure and muscle cramps. So the answer will be option B. Again, you can see low conductivity means low sodium dialysate. Low sodium dialysate means, now what will happen? There will be movement of sodium out from blood into the dialysate. So what will happen? Sodium concentration inside the blood will be lower, and when there is lower sodium concentration, it will eventually cause muscle cramps. Moving to the ninth question, it says conductivity measurement in dialysis machine works on which principle? So now they are asking for the principle. So option A says light absorption, option B says electrical current flow through ions, option C says pressure gradient, option D says osmosis. Answer will be electrical current flow through the ions. Electrode inside the machine, generally we all know we have two cans and we put two particular rods in here our screen. So what are these two rods? These are electrodes. Inside the machine pass electrical current through the dialysate. More ions allow between the current flow, resulting in higher conductivity. So mainly on what principle they function? Electrical current flow through the ions. Now moving to the 10th question, it says before starting dialysis, conductivity should be, option A says ignored if pH is normal, option B checked and verified, option C says adjusted after dialysis, and option D says measured only on weekly basis. So what will be your answer? So the answer will be, it should be checked and verified, because if conductivity will be high or low, it is going to directly impact the patient and we don't want to risk that. So that's why it should be checked and verified. Incorrect conductivity can cause serious complications, therefore technician must confirm conductivity and pH before initiating dialysis. So hope you enjoyed this. This was all about conductivity. Make sure you like this video and also comment that other topics you want video on. I will try to make videos on those topics also.